Of movement. Coordination of muscle movement means cooperative contraction of separate group of muscles in order to accomplish a definite act. Ataxia is characterized as incoordination due to errors in rate, range, force, and direction of movement. For coordination in upper limbs are finger, nose, chest. Ask the patient to touch his nose and then the examiner's index finger. If he performs these actions without making any errors, he is asked to close his eyes and perform the same action. He is then asked to make a circle in the air with his index finger, first with his eyes open and then with his eyes closed. In the third test, the patient is asked to flex his elbow to a right angle and then alternatively to supinate and pronate his forearms as rapidly as possible. All normal person can do this very rapidly. When the movements are slow, awkward or incomplete, it is referred to as dysdiadochokinesia. Tests for coordination in the lower limb are: ask the patient to walk along a straight line. If incoordination is present, he will soon deviate to one side. Romberg's test. The patient is asked to stand with his feet close together. If he can do this, he is then asked to close his eyes. If Romberg's sign is present, as soon as he closes his eyes, he begins to sway or may even fall. This is present in sensory ataxia. Heel knee test. The patient is asked to place the heel of his leg on the opposite knee and then to slide it down the shin towards the ankle. In cerebellar ataxia, irregular side-to-side series of errors in speed and direction of movement can occur. Gait. Gait means the manner of walking. Some common abnormal gaits are spastic or hemiplegic gait. This is a characteristic feature of persons with pyramidal tract lesions. The patient walks on a narrow base, has difficulty in bending his knees, and drags his feet as if they are glued to the floor. The foot is raised from the ground by tilting the pelvis, and then the leg is put forward so that the foot tends to make an arc. The toe scrapes along the floor. Stamping gait. The patient strikes the ground heavily with the sole of foot. It is seen in sensory ataxia. Drunken or reeling gait. The person walks in a zigzag line and deviates to the affected side due to hypotonia. It is seen in cerebellar lesion. Festinant gait. The person bends forward and walks quickly with short steps as if trying to catch up with center of gravity. It is characteristic of Parkinson's disease. Waddling gait. Waddling means to walk with short steps like the gait of a duck. The feet are planted widely apart and body sways from side to side as each step is taken. The heel and toes tend to be brought down together simultaneously. It is seen in proximal muscular weakness. Involuntary movements. Abnormal movement present in patients are tremors, atetosis, chorea, tics, and epilepsy. To demonstrate tremors, we will take a piece of paper and place it over the dorsal of hand. Tremors can be seen as regular or irregular distal movement having an oscillatory character. Intentional tremors are seen in cerebellar dysfunctions. They are coarse and clearly seen when part is used in voluntary movements. Fine and rapid tremors are seen in anxiety and thyrotoxicosis. In Parkinson's disease, tremors are present at rest and disappears during activity. It is known as resting tremors. Its frequent presence can be seen as pill rolling movement, which is rhythmic contraction of thumb over fingers. By the end of this practical, a student is expected to know the answer of all these questions.